Substance abuse is common across the country, and even some of the most vulnerable can fall victim to it. And one group is working to break the stigma to help. Project Echo says that there is a growing stigma on helping pregnant mothers who suffer from substance abuse issues. They say in many cases it's led mothers to not seek treatment for themselves or their baby.
There was a study done, I think, by the CDC a few years ago that suggested, if you call a clinic, if you call some substance use provider and you say, hey, I have a problem with fentanyl, I want to get help, I want to get treatment, you're more likely to get an appointment if you don't say that you're pregnant.
In an effort to help combat that stigma, Project Echo has been working with providers all across the state to help ensure that pregnant moms and mothers who have just given birth that have fallen into addiction, they receive the care that they need not only for their babies but for their addictions. They provide information and support groups to help figure out the best course of action to take. They say it is hard for others outside of New Mexico to seek treatment because of the criminalization that many of them face if they use while pregnant.
They don't seek treatment because they know that they're going to be criminalized for it. And in New Mexico, thankfully, none of those laws exist, and I hope that we never move to that. Sometimes I hear people who don't know a lot about the subject, oh, we should just put them in jail, or they should be incarcerated for that, and that is not the way to go.
Another problem that they try to help with is the potential that the newborn could be addicted to opioids once the mother gives birth. They also work with other healthcare groups to help provide naloxone training across the state. That is the drug that is used to help combat an overdose. Statewide opioid deaths have gone down by 8% since 2021. For more information on Project Echo and their programs, you can visit our website, krqe.com.